hit record.
Okay, perfect. All right, we'll go ahead and get started. Welcome to Webinar Wednesday through the North Dakota Brain Injury Network. There is our website, www.ndbin.org, and our phone number is 855-866-1814. We just wanted to give you a little background on, to the next slide. There we go. This is a collaboration through NDBIN and the Stroke Association of North Dakota. In 2019, legislation did pass allowing us to acquired brain injuries into the definition of brain injury for North Dakota. So now we get to be inclusive of all types of brain injury. So we've been partnering and collaborating with them on several projects, and this is one that we wanted to bring to you in hopes of reaching all the audiences of North Dakota, the rural and urban. And today we have Rebecca Quinn speaking to us. She's the program director for the North Dakota Brain Injury Network and is considered the statewide expert on brain injury. We wanted to bring fatigue to you today because it's a common issue we see with our clients and it can be very tricky to manage. So she's going to tell us a little more about that and give us some strategies for helping manage fatigue. So thanks, and if you have questions, you can definitely ask them at the end. All right, Rebecca, I'll let you take over.
Okay. So, yeah, fatigue is definitely an issue that we hear about a lot, and I think it's one that we wanted to share today because it is something that there are a lot of people that have questions about it, and I think it's a good one for us to share. And this is one that I've done throughout the kind of years and talked about. One of the things that I like about it, and we have done it with the support group here in Grand Forks, is in it we talk about the energy pie and thinking about your energy as pie. And so we've done it before as part of actually using a holiday pie. So one time we did it around Thanksgiving, and I actually brought pumpkin pie to the support group. So that's why we thought it was a good one for this time of year when we're talking about pie and we all are wanting our holiday pie. So fatigue is definitely a little understood issue. As I said, it's one that is talked about a lot. It's a phenomenon that's not really understood. There's some difficulty around fatigue, particularly the issue that fatigue is subjective. So fatigue is different for each and every one of us. It is not something that is kind of along the line of pain. You know, pain is something that is different for each person. Fatigue is the same way. There's also, unfortunately, no established methods for measuring fatigue. There's not really a way of saying how fatigued somebody is or measuring that. And unfortunately, there are no well-established treatments either. So that kind of makes it kind of a confused, nebulous issue. I will say, so the graphic on this slide, brain drain, wake up to fatigue, actually is part the British Brain Injury Headway is basically the British Brain Injury Association. And they did a whole year-long campaign in 2019 around fatigue and brain drain, and have some great resources on there. So that is the graphic from their brain drain fatigue kind of campaign they did. So I welcome anybody to go look at Headway's website. They have some great videos and things like that around fatigue. So what is fatigue? This is the fancy definition that is sort of a confusing and says a whole lot. But fatigue is the awareness of a decreased capacity for physical and or mental activity due to an imbalance in the availability, utilization, and or restoration of resources needed to perform the activity. So basically, it's your awareness that you have decreased capacity because of limited availability of resources. That's basically, and that quote is from the Essential Brain Injury Guide. Fatigue is very common after brain injury. Studies show that as many as 70% of individuals with brain injury complain of fatigue. It is often called the most debilitating consequence after brain injury, but it's not always understood. One of the reasons why it is often called the most debilitating consequence is because it's then impact on everything else. Fatigue impacts, all of the other consequences or deficits somebody might have after brain injury. So how fatigued they have will affect their aphasia, or how fatigued they are might affect their, gait. So fatigue, not only in and of itself is a symptom and a deficit, but then how it affects all of the other things makes it even more debilitating. So it definitely is something I would say it's rare for me to run into an individual with brain injury that does not complain about fatigue or doesn't have some story or issue around their fatigue. So it's definitely but as I said, often not understood. This is a quote, often it can creep up. It may not be so noticeable until you reach a crunch point where you become aware of that. I just can't deal with this anymore, or you can't think straight. So that is something that often people with brain injury complain about regarding their fatigue is it's all well and good to talk about how to manage it, but sometimes they're not even aware or notice how fatigued they are until they just reach that tipping point so much closer. So when they reach a wall, they reach a wall. And that is something that a lot of times individuals will talk about is that they'll be going fine and then all of a sudden they slam into that fatigue wall. So in talking about fatigue, there is normal fatigue. Normal fatigue is something that we all experience. Everybody in the world experiences fatigue at some point in their life. We've all had times where we've stayed up all night studying, or we pushed ourselves because we were, going on vacation and we had a long day of flying, whatever. So everybody has normal amount of fatigue. But usually normal fatigue is time limited. So it's only based around a situation. And then it's alleviated by rest. So in the example of going on vacation where you pushed yourself for a long plane flight, it's time limited, it's short, it's around that period. And then once you have a few days to rest and get caught up, it goes away. So that's really traditional normal fatigue that everybody experiences and we think of. Now, pathological fatigue, which is usually the type of fatigue that's experienced following, a brain injury, that persists for long term. It's present most of the time. It may not improve with rest, and it's likely to significantly impact an individual's life. So really that's the distinction between when somebody says, we all get fatigued sometimes, versus somebody with brain injury saying that they're experiencing fatigue. Their type of fatigue is different because it does fall into these categories. So it's not as simple as them just needing a Sunday afternoon to rest, but it's this ongoing pathological. So another quote, fatigue has stopped me doing many things which I've wanted to do. I feel miserable about this, and more so for being tired. I get muddled about what it is I should be doing, how to do it, and where when I'm tired. So a lot of times that fatigue is impacting even the ability to do activities and participate. So, and that's part of this impact of fatigue. Again, impacts everyday life, work, school, social interactions, leisure. When you're fatigued and unable to do these things, it then, impedes things. Again, as I said before, it worsens other deficits. So whether it be memory, irritability, speech, any of those, it's going to, being fatigued is going to worsen those deficits. And then the way it affects an individual, it can affect thinking. So a lot of times with fatigue, there's some self-blame and some thinking that goes around with it. I shouldn't feel like this. I'm useless. I should just get over this. So it can affect that feeling of self-worth. And then that goes into those actions. So avoiding activities, changes in roles, the changes in, life and roles, particularly around, if somebody's fatigue is impacting their ability to maybe parent or their ability to work. And so that changes their life roles based on their fatigue. And then those both can lead to feelings of frustration, unable to cope, irritability, isolation, loneliness, those type of things that are stemming from that impact of the fatigue. So in laying this groundwork and talking a lot about fatigue, the question is, what causes fatigue? As I said, it's a very common but little understood issue. So after a brain injury, one of the things we know about fatigue is that it occurs more quickly and more frequently than it does in the general population. But beyond that, the causes of fatigue after brain injury are not clear, and it's often a combination of different causes, you know, kind of a multi-pronged effect that is causing the fatigue. So we're going to kind of talk through some of those causes now. One of the biggest pieces of thinking about causes of brain injury with fatigue is that causes can be divided into primary versus secondary causes. And primary causes are those that are directly related to the injury and directly related to damage to parts of the brain that control things like arousal, attention, and response. So not wanting to go into too much detail on this presentation, but they think that there's things like damage to the basal ganglia in the brain and those areas of the brain that really affect things like arousal and how, you know, stamina and those parts of the brain from an actual biological standpoint and physiologically, that damage to that leads to fatigue. And that is thought of as primary fatigue. That's actually related to damage in the brain that leads to those. So, and then secondary causes are really more related to the factors that exacerbate but the fatigue and are fatigue causing in and of themselves. So that might be sleep disturbances or sleep disorders, pain, stress, anxiety, depression. So those all being secondary causes that also are causing fatigue or exacerbating the fatigue from, you know, the primary causes. So those two balanced against each other. And often it's a combination of those two after brain injury, and they're still just beginning to do research on really how those two work together. So, and then the next piece and cause that's kind of this trifecta of these three pieces is the idea of the coping hypothesis. And the coping hypothesis is, and they've started to do research in brain scans to show that the brain functions less efficiently after an injury than it did before the injury. So just it takes more effort for a brain to function after the injury. And along that, there's greater level of effort is required to meet the demands of everyday life, particularly around things like attention, processing speed. All of those things require much more focus just to be doing completing everyday tasks that, you know, many people just take for granted. For somebody with brain injury, they're actually having to do sustained focus in order to overcome some of those deficits. And then utilizing coping strategies. You know, for a lot of individuals, they do adopt coping strategies to help, you know, overcome some of their deficits after brain injury. But those coping strategies in and of themselves take much more effort to be completing a task than would normally be taken to complete a task. So basically the bottom line is injured brains just have to work harder. So you have the primary cause of potentially damage to the areas of the brain that deal with stamina and attention and focus. And then you have all these secondary causes related to like chronic pain and sleep and depression and those. And then you deal with this coping hypothesis and the idea that an injured brain has to work harder. So all three of those together really, you know, and it's hard to pull out which one it would be, but all three of those are kind of working together to be a cause of kind of, you know, prolonged fatigue after brain injury. So now we've kind of talked about those three pieces. Now we're going to shift to talk about another three parts of fatigue. So, and this is the idea that our fatigue and our energy are divided into three different types of tasks that we do. So all of our task and our energy during the day goes to these three different types of activities. And these are sort of the three different types of activities that I also like to call like our, you know, baskets of activities that all of our things fit into. So physical, cognitive, and psychological. Those are sort of the three baskets that you can fit our different skill sets into. And so physical is doing physical activities, you know, that might be walking, housework, gardening. So becoming fatigued physically is a different type of fatigue. Physical fatigue is often one that is most noticeable right away. It does come from doing actual, you know, overstrenuous physical activity. So so working, you know, harder. And one of the things that happens with physical is that somebody might identify, I need rest. You know, is this, I'm tired, I need to rest, I'm dragging today. But often physical fatigue is one that does well with breaks and rest and working on building up stamina. So our next type of energy and then offset fatigue is cognitive. So cognitive activities are activities like paying bills, reading a book, having a conversation, those type of all of our cognitive skills. And cognitive fatigue is really where somebody might come, their mind might become, you know, muddled, or they might have trouble, you know, more trouble with aphasia and word finding after a long conversation, or after they've spent a couple hours, you know, of doing something, then they might not be able to complete tasks as much anymore. And so, you know, after a while, I can't concentrate anymore. It's hard to stay focused. My mind goes blank. And so a lot of times, you know, the cognitive fatigue is what really wears on individuals with brain injury, simply because they're having to do so much cognitive effort for basic skills that they didn't before. Having to do, you know, sustained attention and processing speed and all of that for everything. So then they will just kind of reach a point where they can't utilize those skills anymore. And then psychological. And so psychological fatigue is fatigue related to stress, anxiety, depression. This is more of like an emotional fatigue. So, you know, being depressed wears me out. I just don't feel like doing anything. This might be the type of fatigue that somebody gets from, you know, after they've maybe gone to a therapy appointment and it didn't go as well as they thought it would. And so now they're really, you know, just worn out. They feel like they put in, you know, more effort than they're getting back out of it. And they just don't feel like, you know, it's worth it anymore. And so that fatigue, that just kind of like burned out. And at the end, you know, the end of the day, just going, I just don't think I can do it anymore. And so that's a different type. So when you think about these three types of fatigue, but also thinking of them as three types of energy, because they really are different. And then we have kind of our energy reserves. So before a brain injury, you know, you end up with reserves at the end of the day. So all of us usually have our reserve. We have energy that we put towards the different tasks that we do during the day, but at the end of the day, you have reserves. Before a brain injury, you know, usually somebody will have that. It's rare for somebody to be kind of completely reach that wall, done, and they have stuff. So that means if you do have that day, like the example before of traveling and taking, you know, a long plane flight, you have days that you can pull from your reserve and push through. And we all really rely sometimes on that ability to push through, but it's because we have that reserve. Well, then after a brain injury, the amount of energy you have to put to these type of, you know, energies is greater. So then your reserve is less. And so this was a concept that was originally, you know, called the energy pie, and was originally developed by Mary Lou Imikova, and then was also done in Brain Lash by Gail Denton, covered this as well. And so it's the concept of an energy pie and how it gets changed after brain injury. So before an injury, you might have half of your daily energy is for reserve energy. And that's that backup that you really need to pull from whenever you need some extra oomph. So, you know, if you have a day that's going to be stressful because maybe you have a meeting with your boss, you have your reserve energy that can like bolster you up and pull you through.
I'm doing a conference call.
Your emotional
I'll talk to you in a minute.
Are only taking up about 5%. Was there a question? And then after brain injury, one of the things that happens is that when she explained this, what she explained was the cognitive energy ends up taking up much more than half, takes up like 60% of your energy available after a brain injury. And then the emotional energy is the next biggest hunk, and then physical, but then you end up with just this little sliver that is reserve energy. And so you really don't have that ability to pull from your reserve because there's just not as much available. And so that's why, as I said earlier, a lot of individuals will describe, hitting that brick wall. They get to that point midday and they just hit that wall. And it's because they don't have that reserve to pull from. So this is the one that, as I said, with support groups I've done where we've done actual physical pies at the group and cut them to help them understand, like, okay, how is it different for pre-brain injury, post-brain injury, and then how can you really work on increasing your reserves? What are the ways that you can do that? So here's where you can see the graphics that shows this, where you have the large portion of the reserve energy on the before brain injury, and then after brain injury, the reserve energy is just much smaller. And so you don't have that, as much to pull from. So, and when you have that, there's even less to borrow from. And so all that's really left is that empty pie plate. So, this again is helpful to really kind of think about how to prioritize your energy. Because one of the definite things is that ability to borrow from reserves. A lot of individuals will explain once they get this concept of how much they need to replenish the reserves. So I know last year at our brain injury conference, we had an individual that, was talking about the fact that the conference, because it's a 2-day, full-day conference, really just completely wipes them out. And so, but they now know that. And so they take the 2 days of the conference off to come to it, but then they also take the 2 days after the conference as just rest days because they know they need to rebuild their reserves. So sometimes it's really good to help individuals understand and get that concept of, okay, how can I divide up my energy and deal with my pie? I only have one pie. How do I get everything covered that still can allow me and to help handle and manage my fatigue that way? So another way that I have used with individuals thinking about it is size matters. This is actually a graphic that I got from the Brain Injury Association of Iowa. And so size matters. And they say the average person has a battery pack of 15 hours per day. The average person with brain injury has a battery pack of 4 hours per day. I actually thought that was pretty significant. I'm not sure where they got those because I was like, really, just 4 hours for brain injury? But I think maybe that is. I had one client that explained it to me as an iPhone 4. She said, I feel everybody's running around with an iPhone 10, but I still have an iPhone 4 that can't hold a charge for more than 2 hours. So, but I think any, way of kind of thinking about and just understanding and putting it into an actual kind of concrete way of thinking about energy and how much energy you have is helpful, because it's really helpful to think of it that way, because then it's less of that blame on yourself as an individual and more realizing that this is related to just a change in, the abilities after the brain injury and how to manage that. It's much more easy to manage if you can conceptualize it. So another really important part to pay attention to is signals of fatigue. Really paying attention and learning what are signals of fatigue. And this is something that often individuals maybe won't be able to determine themselves and maybe need some help with. Some help kind of looking like, okay, what are these signals? There are definitely bodily signals to pay attention to. Headaches, dizziness, or tension in the neck and shoulders, slow pace, making more mistakes than usual, those things. Headaches was one that Christabel Braden, who is a national brain injury advocate and speaker, she spoke at our conference last year, and in talking with her, she had really identified that recently she had been doing more activities, and she had noticed an increase in her headaches. And it took her a bit to realize that the connection. She just noticed that she was having more headaches and started complaining about her headaches, but really hadn't quite looped it back to the fact that it was that she had been having more speaking engagement, she was releasing a new record, and so she'd been doing more activities, and really realized that that was her body's way of saying that she needed to slow down. So sometimes it's just having to pay attention to those things and see that as the body's way of saying, okay, hey, this is really a sign that you're getting fatigued. Sometimes people will notice when, as I said, their speech becomes more slurred, or they make more mistakes. Their aphasia becomes, bad. A lot of times individuals will not complain about, word finding and having difficulty with that until they get tired or at the end of the day. So those, paying attention to those, and then checking in with thoughts and feelings. A lot of times things like feeling cranky or irritated, lost interest in normally enjoyable activities, feeling of hopelessness, I can't take it anymore, I can't do this, getting to that wall point. So running to pay attention to those signals of fatigue, because that's an important first step in learning to kind of manage fatigue. So, and in talking about that, next is managing the fatigue. We've talked about kind of what fatigue is and how to think about it, but the piece is really figuring out how to manage it. Unfortunately, there is no single cure for fatigue following brain injury. There's not an easy, quick fix because it is such a complex piece of all the different, components and causes. And it is unique for each individual. Each brain injury is unique. And so as a result, how each individual has fatigue after brain injury is going to be unique. So because of that, managing fatigue really does require a variety of strategies to address the factors that are contributing. Really does kind of take effort in thinking about and how to manage it. And unfortunately, that's easier said than done. I have to say that in doing the research for this and kind of putting together this presentation, there are a lot of things out there that are really easy, like good sleep hygiene and things like that, okay, yeah, we all can maybe know that, but that doesn't necessarily mean it's easy to do. So sometimes using strategies and dealing with it is not as easy as it sounds, and particularly if you're an individual with brain injury. So adopting some of these strategies may be difficult because of the brain injury. So it may be even difficult to overcome that fatigue because of the brain injury. One thing that has recent research has shown does have an impact is cognitive behavioral therapy. And it has found that cognitive behavioral therapy can help with a person's understanding of their own experience with fatigue, understanding their triggers that are leading to fatigue, and their ability to respond. So one of the ways that they're really showing that cognitive behavioral therapy makes a difference is CBT, which is cognitive behavioral therapy, deals a lot with mindfulness and being self-aware. And so really it's helping that individual become present in their present moment and mindful of what's happening with them, and then how to address that. And so really, it's really tough for an individual to adopt strategies if they don't have some of those skills to help them. And so yes, recent research has shown that CBT is helpful around that, but also working with like an occupational therapist or a speech therapist or even PT to help with some of those strategies to alleviate some of the fatigue causing things that are happening, having a better understanding on what's causing the fatigue and how it can be impacting somebody. So really around that idea of a person can't address what they don't understand. So the more they can understand it, the easier it is for them to address it. But one of the really hallmarks with brain managing fatigue is pacing. So is, kind of the tortoise versus the hare thing. The tortoise won the race because it paced, and the hare didn't because it got fatigued and took a rest. So pacing and how to pace out your life and your day really is the hallmark of managing fatigue. And really pacing is just a way of balancing activities, understanding what's going on, spreading out tasks so you can be able to do and complete them. Some of the big things that pacing includes is having regular rest breaks, planning out time and being organized, prioritizing when to use energy, and knowing what your triggers are and working within your available reserves. So we're going to kind of talk through these because those are the pieces of pacing. How do you pace things out? Well, you pace by taking breaks, by planning, by prioritizing. Those are the pieces. Breaks. It's important to take regular breaks after brain injury. I'm actually surprised how many individuals I work with that I talk with them and recommend breaks with them, and they have not implemented breaks into their daily, routine. They don't really understand how to take breaks. I think that's an important piece. For a lot of individuals, they maybe at work might have a break, but then they go and use that break time to be doing other activities. So getting them to understand that that's really not the same. If you're taking a break from your physical, something you're doing physical, but then you use that time to fill it by, doing something that's taxing you cognitively, that's still utilizing your reserves. So helping understand that. Shorter breaks are better than a single longer break. So it's better to be able to take, a shorter few minutes than it is to be able to take a large chunk, because it allows it to be, again, that pacing, that spacing it out. One thing that has been found is many people find it really hard to do nothing. Particularly in today's day and age, we all are surrounded by technology and information and something going on all the time. That it is really hard for people to have time that they do nothing, because either there's too much of a temptation to be doing other things, or they feel guilty about doing nothing. So in those situations, those individuals may benefit from either using relaxation techniques or mindfulness techniques, actually being taught different techniques for restfulness. So this around, there is an app on, a phone or different technology that can help individuals to practice breathing and learning those different relaxation exercises that, can help and make a difference, so that they have something to kind of keep them grounded in that break time. Naps are something that are beneficial for many individuals. However, power naps, taking a power nap, a benefit of a nap is good and beneficial, but it is recommended to avoid naps longer than 30 minutes because more than that, you're starting to really mess with your sleep-wake cycle. And avoid napping after 4 p.m. because then again, you're starting to mess with your sleep-wake cycle and your ability to have good restful sleep at night. So that's one that a lot of times when I have individuals that do have a disrupted, sleep-wake cycle where they have, long periods of wakefulness at night, or they have trouble with falling asleep at night, a lot of times those are individuals that may be napping too much during the day, and really working with them on that understanding of how taking those naps during the day is impacting their sleep at night. So the next part of pacing was planning. So you really want to be, planning out your day. It's one of the things that's beneficial of, the pie analogy, is really thinking about what are the different types of activities that you're going to be doing, and how could you organize your day around that. You want to be able to plan and schedule around your known energy levels. One of the questions that I always ask the individuals with brain injury that I work with is, when is a good time for them? Traditionally, individuals with brain injury don't do so well really early in the morning, and they don't do so well past mid to late afternoon. They're really kind of good from like 10 a.m. to like 2 p.m. That's really their prime time. But that I've also run into individuals that's very different. I have one individual I work with that, 5 a.m. to like 11 a.m. is his prime time. And there are others that really are much better later afternoon, evening. So it all just kind of depends on what works for an individual. But then once individuals know that, that's an important part for them to relay on to providers and family members and to work around. Don't schedule therapy appointments early in the morning if, you need 8 alarms to get up out of bed in the morning and it's still sluggish for you until 10 a.m. That's not going to be an effective time for speech therapy. The same thing with grocery shopping. If you know that late afternoon, evening is really a frustration time for you, you're tired, you're worn out, not a good time to plan grocery shopping. So those are the type of things that helping individuals understand that really actually having the permission to plan for that and work around what works best for them, it is okay. Because I've had many individuals that they just kind of feel that they need to push through this, and somehow if they just had enough will, they would be okay. And then having them see the ramifications of that building up, and that's really just causing more fatigue and more frustration, that is causing more stress and more fatigue, so that they get caught in that cycle. So that's part of that planning piece. Similarly to the example I used earlier about the conference, that was one where that woman said she knew the conference was going to be fatiguing for her, so she planned accordingly to give herself rest days afterwards. So, and then as part of that goes in hand with planning is prioritizing. Prioritizing involves thinking about all the activities that you have to do, you want to do, all of that, and then considering them. Which jobs are more important or essential? Which activities are enjoyable? What tasks could be delegated to somebody else? Could any activities be done less often or eliminated altogether? There's certain things that being able to prioritize, that if going over to, a friend's house for dinner is, really enjoyable for you and that's a top priority for you, then it may be that there are other things you choose not to do that week in order to get to do that. Or if going to a friend's house isn't really that important to you, but making sure you make it to your therapy appointment is, then you may cancel with your friend in order to be able to have the reserves for therapy. So it's part of that prioritized thinking and giving yourself permission to be prioritizing, to recognize that, particularly after a brain injury, you're not responsible for everybody else's happiness, or you're not responsible for meeting every need. You really have to prioritize around what's going to work best for you and what's going to work best for your, health level and your activity level. So sometimes that prioritizing does mean making sometimes some decisions around that. And a lot of times individuals might need some help thinking through this with somebody that maybe doesn't have a vested interest in them. It might be really hard to have a prioritizing conversation with a friend if doing activities with them is one of the activities that you have to prioritize. So sometimes that might be better that's something done with a therapist, or, a friend that maybe you don't do activities with. So those type of things. So sometimes it's helpful to be able to, even if you're somebody that's working with somebody, offering that up as a conversation. Well, what do you feel is the most important? Because it might be that they don't have other people to have that conversation with. So part of this is also thinking about triggers, and we talked about planning and prioritizing and all of that. You have to really think about what's triggering the fatigue. And what is triggering for fatigue will be different for everybody, because each person is an individual. Some things are considered more triggering after brain injury than others, and are kind of known to be triggers. Some, examples of activities reported to be tiring following brain injury include, working at a computer, dealing with paperwork, things that take that high cognitive level, bright lights, being in a busy environment, noisy place, things that cause, stimulation overload, shopping, sustained attention to task, therapy appointments. All of those type of things can be triggering because they require a lot of work. Working at the computer, a lot of people have sensitivity to lights. So they might have sensitivity to computer lights, fluorescent lights, those things. I had one individual that really working with him, we really determined that Walmart was a big trigger for him. And he, and talking with him about it, it was large, it's noisy, it has the big lights. He had a lot of difficulty with peripheral vision. So given that it was such a wide open place, he would have just a lot of overstimulation happening. And so we kind of talked about, okay, well, why are you going to Walmart? Like, there are a lot of places that you could be getting those items other than Walmart. And then talked about if he does need something specifically from Walmart, that better times to go. 5 p.m. is not the time to go to Walmart, but Walmart at 9:30 a.m. is actually quite nice. So we kind of talked around, ways that he could strategize when he did have to go, because it was such an identified trigger for him. It just kind of sent him into an overload. So thinking about those triggers. So part of monitoring and even determining triggers is really considering monitoring fatigue by rating. Rating how high of a feeling of tiredness before or after activities. Kind of trying to see, okay, I'm going to be going out to lunch with friends today. I'm feeling pretty good. Okay, I'm not fatigued at all. I only have, about a 1 on my fatigue scale. And then when you get home in the afternoon, say, I got home from lunch with friends. My fatigue is a little bit higher, but right now it's only still about a 5. So I think I'm okay. I think going to lunch with friends is fine. But then maybe a week later, you might also go to lunch with friends, but come home and be like, oh my gosh, I feel like I'm a 12 on the, 0 to 10 scale now. Why am I so off? Da, da, da. And so then you might realize, oh, well, last week my friend picked me up, but this week I drove. So maybe it's the actual driving that's more fatiguing for me. And I can handle lunch with friends, but I can't handle it if I have to be the one that drives. So getting this idea of which activities are more or less fatiguing can then help with that prioritizing, that planning, to really set those realistic targets, and then help ultimately with that pacing of, okay, what could I be doing? And really being able to be on the lookout for those triggers, and then being able to plan for them. My example of the gentleman in Walmart being able to say, okay, Walmart's overwhelming, so you're not going to go during high traffic areas, or you're going to make sure to wear, your tinted glasses inside so that the fluorescent lights don't bother you. Being able to really determine what are those triggers for you to then help, accommodate them. And that's a piece. So when to seek help. I think a lot of individuals after brain injury complain of fatigue. But often, one, I do see a lot, it falls on deaf ears. It is seen as part of this, whole presentation that it is a component of brain injury. It's something that individuals, often have, and there's a high incidence of, but there's not much known about treatment or how to handle it. So a lot of times individuals don't know, okay, is this just something I should deal with? This is something I'm actually dealing with an individual right now about, and have really said to her, I think it's time for you to seek help about this. I mean, I know you're fatigued, but I think it's time for you to seek help. So I sort of been thinking about that with that individual. I thought important to put this piece in here and talk about this of what were the things that I was looking for in order to then counsel her on, say, okay, it's time for you to seek help. And one of those was too tired to get out of bed during the day. That was something this individual had relayed to me, that, on multiple days, they felt too tired to get out of bed. They would only get up to, have meals and then go back to bed. Or only got up when they were, had to go to the bathroom or have something to drink. So they'd really kind of have taken to their bed. And it was really at that point that fatiguing, sleeping that long. So that was really a sign that I felt needed more intervention. The fatigue is getting worse. That also is something with this individual. I've worked with this individual for 3 to 4 years. Her brain injury is over 10 years old. The fact that this has been new symptomology and is getting worse, to me also is something that should be looked into rather than just chalked up to the brain injury. Because the brain injury is 10 years old, she should be pretty stable with it. So the fact that fatigue is getting worse to me is a sign that something else might be going on. Cutting back on enjoyable activities. It's one thing for individuals to cut back on activities to control their fatigue and to manage it. But when they start cutting back on enjoyable activities and are unable to even make time for those enjoyable activities, then that is a sign that it really is more of a, deficit and a problem in their life than, it should be, and wanting to seek help. Particularly because one, that could be a sign of, some increasing depression going on. Or it could be that it's the fatigue, but their lack of ability to engage in enjoyable activities is then going to be leading to some depression. So kind of creating a cycle there. So wanting that intervention. Not sleeping well at night. Anytime that somebody complains of fatigue and, didn't really get much into this, into sleep disorders and maintaining sleep hygiene and things. But if somebody's not sleeping well at night, and that's a part of it, really wanting to, have them follow up with a provider regarding doing a sleep study. For many individuals with brain injury, they also do have sleep disorders. So having a sleep study done and some sleep hygiene intervention and really work on how getting that good quality restful sleep. Those are important components and something they would want to seek help from a provider on. Anytime fatigue seems related to emotions or pain, so chronic pain being a big contributing factor to fatigue. And so if somebody is in chronic pain, wanting to have some interventions and to see how they could lessen that pain and be able to alleviate that to then help with the fatigue. And then anytime the fatigue seems related to emotions, again, part of that, fatigue, depression spiral and cycle, wanting to be able to intervene on that and, get psychological help if they do need that help regarding the depression or anxiety and things that they're dealing with. And then also part of if their thinking is often affected by fatigue. So if they feel that their cognition and their ability to think is overly impacted by the fatigue, that also would be a time to seek help from a provider and somebody to help kind of more at a professional level manage that fatigue with them. So an important part of this is also medical considerations. So again, individuals with brain injury are just like everybody else. So they have lots of other things going on as well. And the brain, back to that primary fatigue, there are medical causes of fatigue that have to be either considered or ruled out. And that be important to look at with that, when to follow up with a provider and important looking at as far as managing the fatigue. Hormonal abnormalities would be a start. There is a high incidence of hormonal abnormalities in individuals with brain injury, things like hypothyroidism, hyperthyroidism, difficulty with pituitary glands, all of those things that can lead to hormonal imbalances, and those having an impact on fatigue. So those should always be looked at by a medical professional and potentially ruled out. Nutritional deficiencies, this being related to one, you always want to make sure that you're having a, healthy, balanced diet and proper nutrition and hydration after a brain injury. Hydration is one that I think a lot of individuals with brain injury are not properly hydrated as much as they could. Part of that being related to actually hydration is a memory and attention thing, just even remembering to take a drink. That is problem within the dementia population, of having to be reminded to take, a drink. They do make like water bottles that have flashing lights on them and things to help individuals to remember. But so being able to, at a base, maintain that proper nutrition, hydration, but then also nutritional deficiencies can be common after brain injury. So being low in things like B12 or being anemic and having low iron, vitamin D deficiencies, all of those things can lead to fatigue, and fatigue being a symptom of them. So wanting to make sure that those are looked into and could be managed that way. Sleep disorders, as I said, looking into how effective somebody's sleep is and if they have a sleep disorder. I have many individuals with brain injury that have CPAPs and working with them on that and getting them, effective that related to sleep apnea, those things. So good quality sleep is necessary in order to not be fatigued during the day. Addressing any psychiatric issue like depression or anxiety. Those do need to be addressed. I will say with clarification, however, I think that sometimes when I've worked with individuals, I see a lot of times their fatigue is chalked up to depression, and there's really not enough recognition of all of the other components of fatigue that come after brain injury, and then even looking into some of these medical, because sometimes it's too easy to say, oh, you're tired, or oh, you don't want to get out of bed, that's depression, without realizing that there are all these whole host of other things going on after a brain injury that could also be contributing factors. So you don't want to be ignoring the depression and anxiety, but you also don't want to be saying that fatigue after brain injury is always related to that. Chronic pain, as I said, chronic pain can be debilitating and causing fatigue in and of itself during the day, but also chronic pain being a detriment to getting good sleep at night. And so that having a negative impact on both sides. So any chronic pain, really wanting to address that, particularly for individuals that had any orthopedic injuries as well as part of their brain injury. Chronic migraines can be problematic after brain injury. So those type of things that really disrupt sleep cycle and then really affect energy reserves and fatigue. And then also looking at any sedating medications. So many medications have sedating qualities, and a lot of them are medications that individuals have to be on or they are on after their brain injury, but really wanting to look at those sedating medications and are they having an impact on the fatigue, and that being something they can work with their provider on. Sometimes it can be as easy as, yes, it's a sedating medication, and so as a result, you can take it at night. But other times, it may be looking at, is there an alternative medication that could be used? Or is there a lower dosage? What is the purpose? So really doing some of that medication work. And that's something that can be worked with a provider, as well as I also will say a pharmacist. A pharmacist, I always feel, are one of the highest underutilized medical professionals we have. Very rarely, people, whenever you fill a prescription, you're always asked, do you have any questions for the pharmacist? And that's always your opportunity. Pharmacists do have doctorates in pharmacology. They are experts. And so it is something that pharmacists really are a good resource of if somebody just has questions about, are any of the medication you're taking have sedating qualities, or how do they interact together? Things like that. So, utilizing a pharmacist in that way around sedating medications, and even having the pharmacist work with, your provider to think about that. So medications are a big piece to think about as far as sedating qualities. And then the next piece is also medication as far as addressing the fatigue. Medication for fatigue and for fatigue management is an option for those who don't seem to be improving. Or when the fatigue is functionally disabling, when the fatigue seems to be an impactor, particularly around things like stamina, arousal. Those are areas, that primary fatigue, when those areas of the brain have been impacted, having a medication that can help with that and help overcome that can alleviate some of the difficulties that an individual is having. There's a wide range of medication, and since I am not a prescriber or a pharmacist, I'm not going to go into all of them, but I do find that there is a wide range. Some of it can be just mild, pro-arousal agents that are just medications that just sort of help with somebody being more aroused, their brain just being kind of more awake. all the way up to stronger psychostimulants, and using, you know, some of your common psychostimulants, like around like Ritalin and Adderall and things like that. You know, what's thought of as like ADHD medication, your stimulants, those are used as well. And I throw this out there because a lot of times I will have individuals that are prescribed these and then really don't understand why they're on them, or then feel guilty that they are on these stimulants. And so helping them understand that this is part of those medications are there to help be stimulating part of your brain that is not functioning now and you're having difficulty with after a brain injury. I think it's really important for individuals to have an understanding of why they might be taking these medications, and then how those medications can help them manage the fatigue. It may be without the medication, they don't have the ability to implement some of these coping strategies. But once they have the medication, they are able to implement them and much better manage the fatigue. So I think medication is an important option, and that is a component there. So here is a really long list of a lot of measures of fatigue scales. These are mainly scales that you would want to, as a provider, to be using with an individual to kind of do scales with them. I do have a list of these and can send this, you know, presentation out if anybody has any questions. If you just shoot me an email. They are they are different, and they all kind of look at different things. They are ones that can be used depending on what situation you're in, and how you know, you're wanting to be assessing somebody. But none of them are really standardized, well utilized, or I would say widely available and used. They really more are because because fatigue is subjective and the scales are so unique to different situations, but they are ones that individual providers could be using in different settings. So I do include them for that, for just kind of having that, you know, that understanding. So that's kind of as far as, you know, I had for the presentation today. I wanted to, you know, cover things that I thought were important, but also have an opportunity to, you know, get some information out there, and some things that I had seen were important after brain injury, but also for, you know, there to be the opportunity of an understanding that fatigue after brain injury has these different components. But it's not as simple as saying to somebody, oh, just wear a hat if you're outside, or just wear tinted glasses if lights bother you, or make sure you get good sleep. Those are all components, but it really depends on what's going to work for that individual. And for individuals, really just giving them permission to have an understanding that their brain has changed after the brain injury, and it's going to affect how they think and how they you know, can manage their fatigue. And so as individuals give themselves that permission and have more understanding, that can help how they adopt accommodations and move forward, and helping them explain it to family members and those around them. So I don't know if anybody has any questions or had any additional information they would want to share about fatigue. No? Okay. Well, I mean, I just thought I'm glad that we covered this topic. I think it's a really diverse topic. It was one that it was tough for me to even decide what I would kind of fit into a short period, but I tried to go based on the different conversations and information I'd heard from individuals over the years, and the things that I have seen be beneficial for individuals and for them to be able to be components of it moving forward. So thank you. We appreciate you all joining us today.
Yes, and I just want to say, if anyone has any ideas on any other topics, or knows of any good speakers, or would want to speak yourself, let me know. My email is on our website and on the flyer that you saw this on. So let us know. Thanks for coming.
Thank you. You have to hit